Milkman, the paper boy, evening TV. You miss your old familiar friends, but waiting just around the bend. Everywhere you look, everywhere there's a heart, a hand to hold on to. Everywhere you look.
Doctor, come in, hurry. Okay, so you take the right side and I'll take the left.
Did you check the axial skeleton, which includes the head, neck, and trunk?
No, but I did do the appendicular skeleton, which consists of the appendages, which is also the limbs.
Good, and do you know what superior means?
Well, in med school, we learned that it means that it's towards the head. For example, the nose is superior to the neck.
Perfect, and therefore inferior means away from the head, such as the nose is inferior to the eyes. And anterior means toward the body, like the stomach is interior to the spine.
And also, posterior means towards the back of the body, like the heart is posterior to its ribs.
Good, I see that you've been studying in med school. Now tell me what medial and lateral means.
Okay, Doc. Medial means that it's towards the midline, and lateral means that it's away from the midline.
Correct, like how the ears are lateral to the nose, and the sternum is medial to the hips. And now tell me what proximal and distal mean. A little hint, you're different from the rest of the others.
Yeah, Doc, I know. Well, you see, they're different because they only apply to the limbs. Proximal is close to the limb's attachment point, and distal is further away from the limb's attachment point.
Very well. An example of that would be the knee is distal to the toes, and the upper arm is distal to the shoulder.
Just so you know, the cut over here is superficial, meaning that it's towards the body's surface, while the cut over here is deep, meaning that it's away from the body's surface.
Exactly. Like the skin is superficial to the veins, and the tongue is deep to the lips. Let me quiz you on some different topics. What is the dorsal body cavity?
Okay. Well, it protects the nervous system, and it includes the spine and the brain. The brain is a subsection called the corneal cavity in the skull.
Yes, and the spine runs within the vertebral cavity, which encases the spinal cord.
Doc, I'm still a bit confused with the ventral and thoracic body cavities, though. Can you please explain them to me?
I thought you were better than this, but okay. So basically, the ventral is anterior to the dorsal cavity and contains internal organs, and thoracic is superior to the abdominopelvic cavity, contains the heart and lungs. Simply, it's basically your chest area.
Well, at least I know what abdominal pelvic cavity is. It has two categories, abdominal and pelvic. The abdominal contains the stomach, intestines, spleens, and liver, and other internal organs, while the pelvic contains the bladder, reproductive organs, and rectum.
Good job. Let's let the patient rest for now.
Okay, let's get the shift over with. We need to prep the patient for surgery. What kinds of cuts are the surgeon going to make?
Well, they might cut the arm in the sagittal plane into right and left parts, or specifically the mid-sagittal, which is along the midline, or the frontal plane, which divides the body into anterior and posterior parts.
I think they might make a transverse plane cut, which divides the body into superior and inferior parts, and they might cut the right upper quadrant.
Ah, that's a good prediction. They might also cut into the left upper quadrant.
Nah, I don't think so. The right lower quadrant seems more likely.
Really? If they're going to be cutting into any lower quadrants, it's going to be the left lower quadrant over here.
If you're going to be talking about where the cuts will be made, we should guess it quick. Over here is the right hypochondrial region. It's in the right upper quadrant.
Okay, and this section here is the epigastric region, right? I need to refresh my memory.
Yes, and the opposite, the right hypochondrial region, is the left hypochondrial region.
Of course, and here's the right lumbar region. I remember now.
Yeah, and the section around the belly button is the umbilic region.
And of course, next to it is the left lumbar region.
Yeah, and the right iliac region is here too,
with the hypogastric region next to it in the middle.
And finally, the left iliac region is here.
Thanks for prepping the patient for surgery.
Surgery? What surgery? I thought you guys already operated on her.